Everyone. My name is Rakhi Justin Sudha. My student ID 167391226. Here is my team members.
My name is Sandra. My student number is 155198229.
My name is Anne Maria Jose and my student ID is 167392224.
My name is Bensimol Bensigar and my student ID is 155493224.
So let's move to our topic. Our topic is drug addiction in youth and younger generation, a community assessment in Toronto. Introduction. In Toronto, the escalating concern of drug addiction among youth necessitates a comprehensive community assessment. The youth demographic aged 12 to 24 faces an increasing risk, endangering both individual well-being and community cohesion. This assessment aims to resolve the complex dimensions of youth drug addiction, exploring social, economic, and cultural factors. By identifying root causes and risk factors, collaborative interventions can be developed by community leaders, policymakers, and healthcare professionals. Sensitivity to the multifaceted nature of addiction underscores the necessity for a holistic approach aiming to empower Toronto's youth towards healthier lives. Then, statistics and data. In Toronto, the surge of drug addiction among the youth aged 12 to 24 demands attention backed by compelling statistics. Recent research reveals a concerning rise in youth drug addiction cases, posing severe threats to both individual well-being and community stability. According to the Toronto Public Health, the rate of substance abuse among youth individuals has increased over the past 5 years. Additionally, hospital admissions related to youth drug overdose have been staggering increase. Understanding the gravity of the situation is vital for informed interventions, collaboration among stakeholders, and the development of effective support system to curb the escalating impact of drug addiction on Toronto's younger generation. From my personal experience, when I was practicing community health back in India, I visited a client home who was addicted in drug. When he was in school, he was a talented and bright student, fell prey to the clutches of drug addiction. His descent in the substance abuse started innocently enough with the peer pressure and decided to fit in. As his drug use escalated, his academic performances plummeted. I visited and educated him the consequences about as much as how I could do. I collaborated with local school community leaders and other healthcare professionals to develop a comprehensive approach to tackle the drug addiction. Now he improved, he developed with the help of community health nurses and other community health nurses and rehabilitations. So, community health nurse played a vital role to break in the chains of addiction that had gripped the youth. So, next will be continued by Sandra. Thank you.
Next, moving on to the adverse effects. The first adverse effect is the cognitive impairment. Cognitive impairment refers to difficulties with cognitive functions such as memory, attention, problem solving, and language. Next is the mental health disorders. The overuse of drug may involve mental health disorders such as schizophrenia, bipolar disorders, eating disorders, depression, and anxiety disorders. Next is the physical health issues. It also causes physical health issues such as cardiovascular diseases, diabetes, respiratory disorders, and musculoskeletal diseases. Next is developmental delays. The overuse of drugs may cause the lag in achieving milestone, typically from a child's age. This delays cognitive, motor, language, and social skills. Next is the impatience academic performance. If impatience impact academic performance, strategies such as time management skills, goal settings, and breaking tasks into smaller and more manageable tasks may be beneficial. Next, moving on to the next slide. The other risk factors are overdose and death, legal consequences, physical strain, risk taking behaviors, and social isolation. Next, I'm going to deal about the prevention and education. To mitigate the rising tide of drug addiction among Toronto's youth, a proactive approach to prevention and education is paramount. Collaborative efforts must be directed towards comprehensive awareness campaigns targeting schools, community centers, and online platforms. Implementing evidence-based education program can empower your young individuals with the knowledge and skills to make informed decisions about substance use. Early intervention strategies, including counseling services and peer support networks, should be readily accessible. Engaging parents and educators in open dialogues about the risk and signs of drug abuse is crucial. Furthermore, creating a supportive environment that fosters resilience and emotional well-being is the key to preventing substance misuse. By prioritizing prevention and education, Toronto can fortify its young youth against the allure of drugs, cultivating a community that is not informed but also actively involved in shaping healthier and more resilient future. Thank you.
So I'm going to continue with the topic so we can deal with the role of nurse. First point is the education and prevention. We all know that the community health nurse contribute about the education and prevention about the diseases, and the community health nurse contribute to awareness campaigns in schools and communities in order to gain knowledge about the disease conditions and also educating the youth on the risk associated with the drug abuse. They can also provide information on healthy coping mechanism and also for the peer pressure resistance and consequences of substance misuse. Next is the early interventions. Nurses are often involved in early identification of at-risk individuals, and also they can contribute or collaborate with schools and community centers in order to recognize the signs of any abuse or and also we can provide them timely interventions. Next is the collaboration. Collaboration means we can collaborate with the healthcare workers or healthcare professionals, community leaders, and any nurses contribute to the development and implementation of these comprehensive strategies to reduce the drug addiction, and also we can address about the drug addictions. Next is the community engagement. The community health nurse actively engage with local communities to understand about the unique challenges and dynamics related to drug addictors. The next is the supportive services. Nurses plays a vital role in connecting individuals struggling with addictions to relevant support services. We all know that they want a support from other individuals or any services in order to regain their strengths after this abuse. And also, they may facilitate access to the counseling, rehabilitation programs, and the mental health services. Next is the data collection and assessment. That means the nurses contribute to the community assessment by collecting and analyzing the data related to drug addiction trends. Next is follow up and long term care. We all know that the nurse's main role is to follow up and we give long term care to that clients. Community health provides ongoing supports to the individuals and for their recovery. And also we can help them by navigating them the challenges maintaining a drug relief lifestyle, and also this may involve the monitoring progress, often offering a counseling and facilitating them to assist to continue the care. These are the main role of a nurse in drug addiction. Next will be continued by Bensi. Thank you.
So the balanced role of nurse that we're going to discuss about is parental involvement, holistic well-being, interactive learning, that is access to resources. In parental involvement, we must educate the parents about the adverse effects of drugs and what are the consequences of taking drugs. Then holistic well-being, the interactive learning, that is access to resources. Next is the health education. There are main two key points to health education. They are early prevention and healthy coping mechanism. As we all know, prevention is better than cure. Early prevention is very much needed. We must inform the school, parents, and everybody to provide an awareness to the children who are at youth age. Then conclusion. Confronted with a growing challenge, the Toronto community is conducting an example of youth drug addiction, targeting individuals aged 12 to 24 with the goal of gaining a thorough understanding and implementing effective measures to tackle this urgent problem. Data indicates a concerning increase in cases, posing a threat to both personal well-being and the stability of the community. Emphasizing prevention and education, the approach advocates for proactive evidence-based programs to empower youth with knowledge and resilience by bridging gaps in support networks and fostering community engagement. Toronto endeavors to build a healthier, more informed and resilient environment for its younger generations. So thank you. That's all about our topic. Thank you. And next is the reference that we used in this. We used 3 references. And thank you.